Once upon a time, there lived a sweet old couple who supported each other both mentally and physically.
I just follow the sign.
Hello everyone, I'm your news reporter Yang. We're very pleased to have Mr. Leung, the chief organizer of We Care, an elderly-related NGO. So although the attempted suicides by elderly have increased dramatically these days, a 70-year-old man attempted suicide has finally raised the concern of the public. Mr. Leung, do you have any thoughts on this?
Well, I would say this is a really unfortunate case, but it's really just the tip of the iceberg. In fact, people aged 65 years or above, or the elderly, have the highest suicide rates among the age groups in the world, and Hong Kong is not an exception. Reports have also shown that 1 in 10 elderly who suffer some sort of depression leading to suicides at some point.
Okay, I see. So would you please share the underlying causes of this trend with us?
The reasons are actually quite manifold. Firstly, the composition of families will play an important role. Children in Hong Kong or in Asia would leave their homes after they've married, forming nuclear families, and the parents would then become lonely, suffering some sort of depression. Secondly, elderly would have some sort of physical burden at some stage. To name a few, osteoarthritis, back pain, and reports have also shown that pain would lead to depression at children's time. Thirdly, elderly perceive themselves as having low social status, feeling abandoned by society, feeling redundant, useless.
Okay, so are there any solutions for this public health crisis?
Well, in fact, our organization has recently established a 5-year program aiming to take a proactive approach in improving elderly's mental health status, and I'm sure the video later would give you a more comprehensive picture.
We Care's 5-year program consists of 3 main interventions, where the app will be made available on January 2021, while the community support group would kick off in June in the same year. The third intervention, an annual elderly fun day, would take place in October. Early stage evaluations would be carried out in January 2022 to identify flaws and make adequate adjustments, while the final review will be on December 2025 to measure the program's impact.
The first intervention to be introduced is the We Care app. In view of the little monitoring and research that was done to monitor elderly's mental health status, as well as the increasing prevalence of elderly using mobile phones, we believe that the app could effectively address this issue. As a pilot scheme, we are targeting 10,000 citizens aged 65 or above, with e-coupons as an incentive to be distributed after completion of questionnaires at half-yearly intervals. The main objectives of the app is to, first, monitor elderly's mental health status and carry out necessary interventions at an early stage. Second, raise concerns about the importance of elderly's mental health and encourage further research to be done. We believe that elderly under pre-contemplation and contemplation stages would most benefit from this intervention. The questionnaire, with reference to the Geriatric Depression Index, is available both in print and speech, making it easily accessible even for elderly with visual impairment.
你大部分時間心情還可以嗎？
After the completion of the questionnaire, the score will be shown, which will be sent to social workers, universities, and related government departments for follow-up and studies. A tailor-made music playlist will also be available in correlation to the score. Apart from the questionnaire, a SOS function is also available, which would allow the elderly to directly contact the emergency department. Elderly would also be able to join the community support group through the app, which would be explained in detail later. Yet, we do expect several challenges to be seen. For instance, the lack of smartphones might hinder elderly's participation, and we might not be able to reach the most vulnerable group, which are usually self-isolated from the society.
The second intervention to be introduced is the community support group. In view of the low perceived social support as well as different reports showing the effectiveness of peer guidance and engagement in cultural activities in relieving depressive symptoms, a total of 11,000 citizens aged 55 or above would be recruited. The main objectives is to cater the needs of present as mentioned, namely to create closer bondings between elderlies living nearby and to encourage them in participating cultural activities. This idea is also supported by different models, which advise social support in improving the mental health of elderly. Step 1. NGO would play the main role in inviting their members to join the community support group. Elderlies living nearby would be arranged in the same group, while online registration is also available. Step 2. Among the participants, 1,000 of them would be invited as leaders with e-coupons as an incentive to be distributed after the completion of mental health first aid training courses provided. Step 3. One leader is expected to lead around 10 participants in arranging self-organized events like Major Section through a WhatsApp group, while NGO would also organize mass activities such as Qigong for all participants to join. Each group will also be assigned with health professionals for online consultations, accessed by social media such as WhatsApp. Zoom section would also be held by physiotherapists from time to time, covering contents such as stretching exercise which would benefit those elderly who are less willing to leave their home. Step 4. Leaders have to report progress to respective NGOs monthly, while further problems or suggestions would be reported to related government departments by staff. Yet, we do expect several challenges to be seen. For instance, leaders and participants may drop out in the middle of the program, and the high flexibility of programs may result in variant outcomes.
The third intervention to be introduced is the Elderly Fun Day, which includes a sports competition in the morning and a carnival in the afternoon, targeting the general public. In view of the low level of social support towards elderly and the lack of awareness on mental health, we believe that the activities like the colorful games and the sport competition could effectively address the above issues, and our target audience is the general public. The main objective of this event is to raise the public's awareness on elderly's physical and mental needs, and ultimately aims to create a more empathetic and elderly-friendly community. Also, through the carnival booth, we hope to raise the awareness on our other organized activities. In the morning, when the sports competition will be held, there will be two main events. The first event is a time trial run, where participants will run either 3 or 5 km, with equipment such as the leg weights to imitate the physical burden of elderly. The second event is the 800-meter obstacle run, where participants will have to walk on uneven roads and stairs while wearing the visual impairment goggles. Here is a demonstration of the sports competition. Hope you enjoy it.
A carnival will come next after the sports competition, which will be held in the afternoon. There will be a lot of booths with activities for participants. Here are some examples of the booths. In this first booth, participants could dress up and interact with others while role-playing as an elderly. The next booth is for recruiting volunteers to help with the other activities in our program. People will be introduced to our program and will be able to register immediately as volunteers. The last example was the storytelling corner. This is a booth where the elderly can share freely stories or anything they want with an audience. Here are some expected challenges. For finance, we might have trouble gathering sufficient sponsorships and donations for all the activities on this Elderly Fun Day. Moreover, we hope to involve the elderly for this fun day, but in reality, the elderly might not be fully attracted to join.
The impact of the program would mainly be measured in 3 ways. Firstly, the scores of the WeCare app questionnaires throughout the time frame. Secondly, the admission number in the Elderly Fun Day, indirectly measuring the effectiveness and promotion. Thirdly, the change in elderly suicide rate. In terms of expenditure, most funds will be allocated to staff income for daily operations and e-coupons as incentives in different activities. With such, around $1,900,000 will be spent in these 5 years.